ostomy kit. Sometimes you'll find them all set up in one. Sometimes you may have to actually collect the items as necessary. This type of closure. This is a ring. This is the wafer. And this is a tool that you will use to measure the stoma. And this is a clean procedure, it does not require sterility. This is another tool that you can use to actually help you cut out the wafer much more accurately if necessary. Of course, this is directions and the ostomy bag itself. I'm going to perform hand hygiene, put on gloves. Okay, so first thing I'm going to do is assess the stoma. And this is the stoma. Remember, the stoma has to be what color again? Beefy red, okay? And you also want to, in addition to assessing the stoma, you also want to assess the skin around the stoma. Cleanse as necessary. You can use a washcloth to clean as necessary. Now that my stoma is clean and I have assessed the stoma, I'm going to now measure so I can cut it. I prefer to use this one, but there's different tools that you can use to measure your stoma. So when I look, this is a little too big, this is a little too small. So this right here, okay, just right. So now I'm going to cut the wafer. I prefer to draw a circle around where I'm going to cut. And then I'm going to cut 1/8 larger than what I originally circled, okay?
Are you just cutting little like slits?
Yeah,
okay.
It makes it easier. Some people, they'll just cut circles around. But for me, it's just a little easier. I'm gonna see. And it's just about right, so I can now cut. Is it gonna be the perfect cutting? Maybe not, but it's not gonna be the end of the world. Like so. Okay. You want to make sure that your ostomy bag is always closed. And you'll see, like we said earlier, you'll see different types of closures. And remember, when you're placing your ostomy bag, you want to place it in a direction where it flows away from the patient, okay? Make sure before you go out and leave that you press a little bit firmly. Some of them you'll hear clicks, but you want to kind of lift up to make sure that it is indeed secured and intact. Yeah. So like here, you see, right here, if I would have left, stool would have came
out from that little crease
from
area.
This right here. So I have to go ahead and press. And I kind of lift it up, so now it's secured all the way through. Now be mindful of the depth of how much you press, because again, you're pressing against the patient's abdomen too, so it can be a bit uncomfortable. You need to empty this ostomy bag. You don't want to wait until it's completely full to empty it. You want to do it when it's like at least a quarter of the way full. If it's halfway full, definitely empty it. Okay. So I will put like a waterproof pad. If you're going to do at the bedside, you can put the basin here. Ask the patient if possible to turn over just to facilitate gravity. I fill this up with water. I'll let the contents empty out as much as possible. Imagine your hand will be soiled. Okay, so be careful. You may find that you may have to change your gloves frequently because it will be soiled a lot, okay? What you don't want is, as you are emptying the contents, it's soiled and then you touching this. That ain't cool.
If you, for quickly, and then this might be bad, but if you take off your gloves, just put it right in there and get new ones, or it should go in the trash, right? Or
oh, you mean, see, let's pretend this was stool. Empty this in here? Yeah, as long as you're gonna throw everything else away, I would have changed my gloves and put on new ones. So with clean gloves, of course, I am getting the fluid and then I'm going to irrigate it What you'll see, I think in the skills video, they use something like a cone where they put the cone, attach the cone all the way up to the stoma to irrigate. Not many places have that. I haven't seen that. All you're simply doing is just irrigating it until it flows out clear. That's one method to empty and clean out this bag. The next method is to simply, with it closed, of course.
So you can only irrigate it once. You
No, you irrigate it until it's clear,
Okay.
as much as you need it. You have to work quickly because remember, this is the new anus. What I like to do sometimes is simply cover this, go to the toilet, and we will pretend like this is the toilet, and then empty the contents, and then I can irrigate it this way. For me, this is easier, but do what works for you. But of course, you have to open, right? And it'll come out that way. There are some facilities in which the toilet, they have like these little faucets over the toilet. If you're careful and you just be mindful again that those faucets does flush out really strong water, you just want to be careful how you put this opening to the faucet so that it does not splash over you. All right, and that's really it with regards to cleaning out and irrigating the ostomy bag.
Would it be bad to have a PPE?
It would not be bad to have a PPE. A gown?
Okay.
It would not be bad to have a gown because again, you're protecting your body from getting into contact with bodily fluids.
Right.
Okay? So it's not a bad thing. Any other questions?
I guess just after we just verbalize we're cleaning up and then hand hygiene.
Yes.
Okay.
Yes, definitely. And put this back.
And then during checkoff, we're also like irrigating it.
You're gonna irrigate. That's part of it too.
Okay.
Okay, I have to check you off on that.
Okay.
And then that's it. Put the bed, of course, in its low lock position, etc.